Hi there, how are you doing?
I'm good.
My name is Andrew. I'll be the nursing student taking care of you today. How are you feeling?
Off. A
Off?
little bit tired.
Yeah. Okay. Can I just have you verify your first and last name and date of birth for me?
Intro, December 30th, 1986.
Okay, looks good. Are you experiencing any pain at the moment?
I feel like full here.
Uh-huh.
And right, my right side of my belly.
Okay, yeah. So yeah, I just wanted to let you know that I'm here to kind of go over your current diagnosis, hepatitis C, as well as giving you some information about the medications you'll be taking, okay? This should take roughly maybe 3 to 5 minutes of your time. Is that okay with you?
Sure.
Okay, sounds good. So you mentioned that you are experiencing fatigue, kind of, abdominal pain.
Yeah.
That is very normal and what's expected of your condition. Hepatitis C is a virus that affects your liver, and what that virus does, it kind of damages the liver cells. So you could be experiencing what's called sclerosis, which is hardening of the liver. Um, so your symptoms are very much in line with kind of the beginning stages of the disease. Um, that's what happens when, your body, when there's an infection or a pathogen in your body kind of like mounts a response. It's called inflammation. And what you're experiencing right now is kind of that response, that inflammatory response. Um, so, yeah, it's a very, very terrible disease.
Oh.
Um, So yes, if you have any questions, please let me know. Feel free to interrupt me if you want.
Yeah,
Okay?
I do have some questions.
Yeah, of course.
How does this medication help me?
Yeah, so good question. Let me go over the medications with you right now, and I can go over like how it's gonna work. Okay. So you will be taking two types of medications. One is a combination of three, so actually I guess you're taking four, but it's 2 tablets. I know it's kind of confusing. If you need me to explain it again, just let me know, okay? So the first medication that you're taking is a combination of sofosbuvir, velpatasvir, and voxeloxacin. This medication you're going to be taking 1 tablet daily, and you can take it anytime of the day. And then your second medication is called ribavirin, and it's also 1 tablet, but you're taking it twice a day. Okay?
So one a day. So the other is 1 times a day, and the other is 1 tablet 2 times a day. Okay.
That's correct. And then you will be kind of going through this course of medication for 12 weeks. Okay? So how this medication works is that it will inhibit the virus from replicating and being distributed throughout your body. Okay, so it should resolve your symptoms. You know, given that you take the medication and you follow the course for the entire duration of the 12 weeks. Okay. Side effects of the medication include depression, suicidal ideation. We want to monitor these signs and symptoms. Okay, so other symptoms could include headaches, dizziness, fatigue, liver and kidney impairment, dark urine, and clay-colored stool. If you're experiencing any of those symptoms, we want you to kind of like let us know, call your provider, and kind of seek help immediately, okay? And then, let's see. I also want to talk about kind of the monitoring that we want to do as well. So you know, if you're experiencing, how to say, if you are also infected with hepatitis B, there's a potential for this medication to reactivate or to flare up the virus. And we don't want that to happen. If that is the case, we want you to come in immediately so that we can assess you and adjust the treatments if necessary, okay? And then we also want you to not take this medication while you're pregnant or you're breastfeeding, okay? So, questions, concerns so far?
Should I take it without or with food?
So you should take both of these medications with food. It's good to kind of reduce like abdominal cramping and abdominal pain, as well as help with the absorption of the medication.
Okay, thank you.
Yeah, of course. Let's see. In the meantime, so I know that you are about to leave home or leave for home. So as you're going through the course of this medication, let us know again if you're experiencing dark urine, clay-colored stool. That could indicate an effect to your, and jaundice as well. That could indicate liver and kidney impairment, okay?
Thank you.
Yeah, of course. Thank you for your time and thank you for your patience.
Thank
I
you.
hope you feel better.
Thank you.
Yeah.
7 minutes.